Hi, my name's Dana Aiken. I'm the Total Joint and Spine Coordinator here at Beaufort Memorial Hospital. I'm also a registered nurse. You're watching Beaufort Memorial's Joint Replacement Program Shoulder Replacement Surgery Preoperative Education class. If you're watching this class, then you probably have a scheduled surgery coming up. So we are going to go over some things that we want you to know before surgery, during surgery, and after surgery. This is an elective surgery, so we have time to put some measures in place. So we want to go through some of those with you. You probably have received a joint replacement shoulder book. So if you have your book, you can refer to it. We'll go over some important points in your book. It is a very good idea for you and your coach or support person to read that book and refer to it. Bring it with you to the hospital when you have surgery, as we might refer to it as well. So again, welcome to Beaufort Memorial Hospital. Our shoulder program is based on a wellness model, meaning you are not sick when you have the surgery, your joint is just sick. So we like to treat you like you are well. We like you to dress in your regular clothes. We have a hall or a joint replacement center that is dedicated to our joint replacements, meaning there are no sick patients down that hall. We encourage coaches and welcome them to be a part of this process before surgery, during surgery, and after. We have a dedicated staff on the unit that is specially trained for our joint replacements and our shoulder surgeries. Part of our wellness model is short hospital stays, including some same-day discharges. If you're going to be a same-day discharge, that's something that you've probably already discussed with your provider. Your rehabilitation journey will begin immediately after surgery, starting with occupational therapy. Before you go into some of the risks and things to expect after surgery, it's really important for you to understand your shoulder replacement and your shoulder surgery. So you are probably at this point because you've tried some conservative measures, or you just have the osteoarthritis, the wear and tear on that joint, and you've probably had some imaging done that has gotten you to this point to make the decision of having surgery. There's some anatomy shown here, what it looks like with the arthritic changes in the shoulder, and then what it looks like with the prosthesis after surgery. You might be having a reverse total shoulder or just a total shoulder. The approach and type of surgery will be something that you will discuss in the office at your pre-op appointment or once you've decided to have the surgery. They also can discuss specific implants and the model of what you will have during surgery as well. So before surgery, just a couple things that we want you to know. Once the decision has been made for you to go into surgery, we have a preoperative evaluation. Again, this is an elective surgery, so it gives us some time for us to optimize you and for you to be in the best condition possible before going into surgery to reduce some of those surgical complications and risks. We will identify any medical or physical conditions, known and unknown. You will be referred to our preoperative assessment clinic or possibly your primary care provider for further consultation or any clearance that we would need prior to you having surgery. Some things that we will check, we might do an EKG, chest x-ray, lab work. So we will check things like your iron levels, make sure that you don't have any urinary tract infections, any lung conditions. We'll screen for MRSA and staph infection. If that does come up positive, there is some treatment that we will do prior to having surgery. Again, we will just look for any cardiac issues. A nurse will review your health history with you and medications in detail. So expect a call from our preoperative nurses. If you are somebody who has a history of anemia or iron deficiency, we do again check those iron levels and want to optimize you prior to surgery, our blood conservation program is a very big part of our joint replacement program. The provider might recommend you take an oral supplement or have some iron infusions prior to surgery. Your blood conservation coordinator information is here. So if you're somebody who has a history already and you want to reach out with questions, please feel free. So some of the surgical risks that we look at with any surgery, but especially with our joint replacements and when you get into the bone, these are some things that we are going to go over. So some surgical risks are blood clot, infection, nerve, vessel, and ligament injuries, poor wound healing, limited range of motion is another surgical risk, hematomas, instability, and loosening. So to get into these a little bit further, you might hear us say blood clot, DVT, PE, which is a pulmonary embolism, a blood clot in your lung. We do put some measures in place to reduce these from happening after surgery. So taking a blood thinner after surgery, all of our surgical patients will go home on some type of blood thinner management. Being mobile as soon as possible after surgery, getting you up and moving you around will help decrease these risks. And wearing foot pumps when you wake up in the recovery room. You might have some foot pumps or SCDs on your feet to increase your blood flow and reduce these risks. We want you to know the signs and symptoms of a DVT or deep vein thrombosis, blood clot, or pulmonary embolism, PE, so that when you get home, you and your coach can also monitor for these things. We, again, sometimes have a very short stay in the hospital. Some patients might go home same day, some the next day. So it's really important for you to understand these to continue to watch for them after surgery. So for the DVTs, we look for pain and swelling in your limb, not relieved by elevation, redness in the color of your skin, and skin that's warm to the touch. If you are, so some of these things are expected after surgery anyway, but if you have them and you're concerned about them or have significant changes, it's important to know the baseline when you leave. And then if you have any significant changes, to definitely call the doctor and just kind of discuss, just to make sure that they don't want you to come in and get checked. For pulmonary embolisms or a PE, those are a little bit more significant and would be more emergent. So shortness of breath, rapid changes in your heartbeat, chest pain, lung or rib pain, kind of that feeling of impending doom, and then feeling faint. If you have any of these, those are things that you might want to seek care a little bit more emergently. Reducing your risk of surgical site infections. So to do this, some things that we recommend are maintaining good physical health, eating nutritiously, especially after surgery, increasing your protein intake, decreasing your sugar intake. Those will help in aiding your healing. So avoid shaving for 48 hours prior to surgery, especially in that surgical area. If you have any open areas that could cause you to your surgery to be canceled. So if you're working in the yard or have any other ways that your skin might be compromised, definitely be aware that having an open area might cancel your surgery. If you're diabetic, make sure your blood sugar is controlled. Uncontrolled blood sugar can interfere with your wound healing and increase your risk of infection. We will monitor your A1C prior to surgery, so be diligent with your blood sugars. Stopping any tobacco or nicotine use, we recommend 30 days prior to surgery for best outcomes, stopping those. And then tell your surgeon if you have any other changes or any other infections prior to your surgery. If you become ill, that's something to definitely notify your surgeon about. Dental care, we recommend that dental care is completed at least 3 weeks prior to surgery and avoided 3 months after surgery. After surgery especially, make sure that you let your dentist know that you have had a total joint replacement. Normal, clean hand washing for your caregivers, make sure that they're performing frequent hand washing as well. and you will want to follow the shower instructions with your antiseptic HIPAA cleansed soap prior to having surgery. So we'll go into the pre-op shower instructions a little bit further. So to reduce your risk of infection, we recommend that you use this HIPAA cleanse that we will provide to you. Use this soap for 5 days, including on the day of surgery. So for 4 days prior to surgery, or you're going to shower regularly using your regular soap and water. Once you've showered regularly, then we recommend that you turn the shower off, apply your HIPAA cleanse, start in that surgical area. You want to apply it to the neck down. You want to stay away from your face and your genital area. Apply the soap, let it sit for a couple minutes. We recommend that you might sing your favorite song, and then rinse it off as normal. Once you start this regimen, we recommend that you put on clean clothes or pajamas, get in a bed with clean sheets, do not sleep with your pets, and then your last shower is going to be on the day of surgery. Do not wear any deodorants, lotions, or powders or perfumes the day of surgery. If you have any questions or concerns about the shower instructions, please don't hesitate to reach out. We also have incorporated pre-op nutrition, so we recommend that you prepare your body for surgery and recovery from surgery with this Ensure Pre-Surgery Clear Carbohydrate drink. The drink we sell in the hospital gift shop. We also sell it in the cafeteria, and if you cannot find it, you can also get it on Amazon or maybe a local Walgreens. If you cannot find it, we have an alternative, which is Gatorade or Powerade. Just do not choose something red in color and make sure it's clear. So the directions for this drink is to drink 1 10-ounce bottle the day before surgery or the night before surgery. Still nothing to eat or drink after midnight. Then the morning of surgery, you can take sips of water with your meds and this 1 10-ounce bottle of clear Ensure, the pre-surgical drink. You want to drink it quickly within 5 minutes, and you want to drink it 2 hours, at least 2 hours before arriving to the hospital. So again, it's your 2 hours before your arrival time, not 2 hours before your surgical time. You don't want to drink it in the car. You don't want to drink it when you get here. You want to drink it at home prior to your arrival. We recommend it to help decrease any post-op nausea, vomiting, and to just boost you prior to having surgery and decrease any post-op dizziness and low blood pressure. So again, if you smoke, we ask you to please stop. The cigarettes and nicotine the forms of tobacco can carry toxins, which affects your body's ability to transport your oxygen and aid in your healing and proper recovery. It can also increase your risk of infection and actually can increase your risk of higher pain levels. So if you can stop completely or reduce the amount that you smoke as much as possible, it's the best outcome is to stop this at least 30 days prior to surgery. So your pre-op checklist, you have a pre-op checklist in your book. So it's a good idea to look at that pre-op checklist. It starts with things 4 weeks out up until the night before surgery. That kind of helps you organize a lot of this information. So it's a good guideline to use in your book. So a couple things, it will instruct you and you will want to know the medications to stop. Again, the nurse liaison will reach out to you. These are conversations that you need to have with your provider. The book gives you guidelines, general guidelines, for instance, to stop herbal supplements if you do the fish oil, some vitamins A and E. There's a long list in there. Some of these herbal supplements can increase your risk of bleeding, so we like you to stop those at least 2 weeks in advance. And then your blood thinners and aspirins, ibuprofens, NSAIDs, Aleve, naproxen, those things we ask you to stop at least 7 days prior to surgery. Some of your diabetic medications, weight loss medications, those will also need to be stopped prior to surgery. But those specific instructions will come from your provider and your pre-op nurse. So again, these are guidelines, and then you may have individual timelines for you based on the reasons why you take them. So just know when to stop and to restart those medications. You want to make sure that you remove fake nails, making sure that you have arrangements to and from the hospital. When you go home, making sure that you have somebody that's there to help you. You will not be able to drive while you are taking narcotics and won't be able to drive until you are cleared by your provider. Go ahead and make arrangements for your home for convenience and safety. Is there clear lighting? Are there items out of your way? Are there, things that you might need to be able to reach, and things that you might need to be able to reach without bending and twisting? Did you remove items that can be fall hazards? And go ahead and pack your bag. Leave all your valuables at home. We have a list of some things that you might need to bring, but go ahead and start preparing all of those things. All right, so what to bring to the hospital? You're packing your bag, and we want you to bring your joint connection resource guide with you. We might use that as a reference, so if you have it, it's good for your coach and good for you. Footwear that you can easily slip into, good traction, a change of comfortable clothes. With your shoulder, you will work with occupational therapy, and they will show you how to get dressed. So make sure that you bring things that are easy to work with. If you have a CPAP or BiPAP machine that you are currently using and you need that, you can bring that as well. Just let your nurse know that that's something that you will need in order for. A payment method, if you're using our Publix bedside delivery, so we do offer a service. There's no extra fee to use it. If your provider is somebody who fills your prescriptions before surgery, you won't need the Publix bedside delivery. But if you're somebody who will have prescriptions, this is a service that we provide so that you and your first mate don't have to make a stop after surgery. You will leave with your prescriptions in hand. They will be filled at Publix just as you would if you were to drop them off. They will be delivered to you before you leave, and you just may have to have a small copay. So bring any form of payment that you would normally use, or amount that you would normally use for a payment at the pharmacy. Some of our blood thinners that we go home on are a little bit more expensive, so the Publix bedside delivery works with our Beaufort Memorial medication reconciliation team, and if there's a coupon needed, we do help make arrangements for that so that you can have those discounts for your blood thinner. If you're someone who had their prescriptions filled prior to surgery and you call and there is a high copay for some of those anticoagulants or blood thinners, please reach out, because we can also make those arrangements for you using that coupon, even if you're getting your medications filled prior to surgery. You will be called the business afternoon prior to surgery to be informed of your arrival time. So you will not know what time to be here until the day before surgery. So just be prepared for that. If you are having surgery on a Monday, you will be called that Friday prior. So preparing to go home for surgery, again, now's the time to kind of prepare your home, make sure your lighting's what it needs to be, your stairs are clear, and your furniture is, appropriate for you to be able to move around after surgery. Your bathroom is set up the way you need it to be. And then go ahead and start thinking about, what car you're going to go home in. Is it going to be comfortable, especially if you have a long drive? So on the day of surgery, you don't want to eat or drink anything after midnight. Again, you'll get those instructions from your pre-op nurse. We talked about your Ensure pre-surgical drink. You want to do that 2 hours prior to your arrival time. Again, not in the car on the way here, not once you get here, but 2 hours for your arrival time. If you don't follow those instructions properly or drink it too close to surgery, it might delay your surgery. So that's just very important. The HIPAA cleanse shower instructions we talked about. So that last shower being the day of surgery, you'll get your phone call the afternoon prior to surgery, and then you'll be taken to the holding area where they will start prepping you for surgery. Your anesthesiologist will do their assessment, and your surgeon will also come and speak to you. So any last minute questions that you or your first mate have, you might want to write those down and bring them with you. so that you can have those answered on the day of surgery when they visit you. So now you're ready to go to surgery. Arriving at the hospital, you want to arrive at entrance number 4, the surgery pavilion, and where the birthing center is. This is going to vary or could vary. We are undergoing some surgical renovations, so just make sure based on the time of year that you are having surgery that you know exactly where to check in. You are going to check in at the surgery lobby desk, and again, that's going to vary where that location is based on where we are in our surgical renovations. You will be prepped for surgery with the antiseptic skin wipe down and antiseptic in your nose and mouth. We'll start the IV, and you'll have a preoperative antibiotic. If we need to clip any hair at that time, we'll do so. We will also examine that skin in the surgical area, so anything that might compromise you or any openings in the skin, make sure that you bring those to the attention of the team so that we can make sure that we're taking you to surgery appropriately and you don't have any risk for infections. In the holding area, you will meet your anesthesiologist and your surgical team. They will probably mark your site. And again, you will have the opportunity to talk to your surgeons as well for any last minute questions. After surgery in the recovery room, it will be a little bright and noisy. We want you to know what to expect. You will have a lot of monitors, and you might possibly have a drain coming out of your shoulder, probably an ice pack on, so it might be a little cold. And then your family is not allowed in this area, but they will have probably already talked to your surgeon. And then after they do talk to your surgeon after surgery, they may wait on the 4th floor. You will probably already have a room assigned to you. Even if you are going home same day, you will still come to the 4th floor, and then we will discharge you from there. After surgery, we will focus on managing your pain and preventing any nausea. Please communicate with your nurse. If you are in pain or if you're experiencing any nausea, don't hesitate to ask for medications. Let your nurse know if your medication isn't working for you. If you know that something has not worked for you and something else has worked for you in the past, communicate that as well. You can also communicate that to your physicians at your pre-op visit. Don't forget, we want to prevent constipation. These medications and narcotics can increase our risk for constipation, so we put some preventative measures in place, like the stool softeners, the Colace, or the laxatives, Miralax. You can continue those regimens when you go home, not to overcorrect. Drink plenty of fluids and eat foods high in fiber, and just be mindful of your bowel regimen. After surgery, again, you'll be admitted to the 4th floor, even if you are a same-day discharge. Your recovery will begin right away. If you have met your discharge goals and have talked about it with your provider, you may go home the same day. You will be cared for by nurses that are trained to take care of shoulder surgery patients. They will perform an extensive assessment. You may be offered your flu and pneumonia vaccines at this time. Your team will be monitoring your vitals very frequently after surgery. They'll monitor your bandage for drainage. They'll monitor your ability to void and making sure that you're able to urinate. They will focus on coughing and deep breathing, showing you how to use the incentive spirometer. The incentive spirometer is very important. We talked about earlier, reducing our risks for blood clots and pulmonary embolism. So making sure that we're taking those deep breaths, also reducing any risk of pneumonia, so you're not moving around like you normally would be. So the incentive spirometer and coughing and deep breathing help us to reduce those risks. We will monitor your pain management, make sure that you ask your nurse for pain medication. This is not something that will be brought to you automatically. So communicate that with your team. We will monitor and making sure that you're able to tolerate food. We will get you up and moving with nursing staff and therapy pretty quickly. Again, we don't want you to do that on your own. we will move with you. And then we will also make sure that your sling placement is appropriate, and we will provide education to you on that and to your first mate or coach, so that when you go home, you know what to look for in the sling placement and how to maneuver that sling. Again, ask for assistance at all times. If you do stay over, you may have some blood draws or lab work the next morning if they're ordered. You will get up to the chair during the day. You will have your occupational therapy visit. Occupational therapy will be done with you whether you're same day or next day discharge. Prior to your discharge, they will help show you how to get dressed. They will help show you how to bathe, how to use your tools, and your sling education. We will also remove the drain if applicable, and they will monitor your drain output. We will, again, pain and nausea management are top concerns, and then you'll have a care coordination visit. The care coordinator will make sure that you have everything that you need as far as discharge planning goes. The OT will focus on your activities of daily living. Again, your showering, bathing, getting in and out of the shower, dressing with or without equipment, energy conservation, and then sling management, putting your sling on and off. You will be provided a shower sling for use while you're in the shower. Again, there's listed some equipment that they may give you as well: reacher, sock aid, long-handled sponge, long-handled shoehorn. So preparing to go home, make sure that you talk to your friends and family and determine what type of help you will have. Do you have someone at home to assist you? Who's your first mate going to be? Who's going to be your go-to person to help you after surgery? This is not something that you want to have and go home alone. Who will drive you to your appointments, your therapy appointments? You may not be prevented to drive again for up to 4 to 6 weeks after surgery. And then again, care coordination will just do a visit to you while you're in the hospital just to make sure that you have everything that you need going home. You also have a discharge checklist in your book. So in your shoulder book, it just goes over some things that you will need to complete and have done or know before you go home. So make sure that you and your coach are comfortable and know all of the things in your discharge checklist. Some of those being incision care. Usually with our wounds, you just keep them clean and dry. There is not any wound care. Your surgeon will be the first one to remove your surgical dressing. Your job will just be to watch for any signs and symptoms of infection, the redness, pain, swelling, prolonged fever, change in drainage. You want to know your baseline before you leave. So look at your wound before you leave, and if you have any changes, just call. You want to, again, be comfortable in knowing the signs and symptoms of a PE and a DVT so that you can monitor those when you go home. Your blood thinner medication, which one were you prescribed and how are you supposed to take it? When is the last time you had it? When are you supposed to take it again? Those are all things that you will need to know prior to leaving. Your sling management, do you know how to put it on? Do you know how to take it off? Do you know the proper placement? Do you have a shower sling for when you were in the shower? Just make sure that you have all those questions answered before you leave. Again, make sure that your pain is controlled. Make sure that you know the side effects of your pain medication, and that you leave with your ice packs that we provide for you, and again, proper positioning. Some post-op instructions, just going a little further, your nurse will go over your discharge instructions and they will give you a copy. It is a great idea to, and highly recommended, to have your coach or your first mate there while your discharge instructions are while the nurse is going over those with you. We talked about a lot of these already. Again, when you go home, it is important for you to know you probably stopped some medications prior to having surgery, especially the herbal supplements, possible blood thinners. You want to know when to start those after surgery. Going home, again, you're going to be on a blood thinner. We want to stay away from any NSAIDs, ibuprofen, Aleve, extra aspirin, anything besides Tylenol that might increase your risk of bleeding. You want to make sure to know what to take and not to take, and when to start those again if you have stopped them. Again, ask your nurse when the last time you had your blood thinner was and your pain medication so that you know the first dose to take when you go home. Some special rehabilitation considerations for shoulder surgery. I expect some swelling after surgery. Use that ice for your convenience. Do your fist pumps at least every hour to compress your muscle and support that circulation. Walking is excellent way to help build your strength. When you're sitting, avoid the low chairs and sofas. Sit on a higher chair with a firm pillow in the seat. You won't be able to push up with both of your arms, so just make sure that you're in a chair that you can get in and out of easily. Another reason to have your first mate or help there after surgery. Do not actively move your shoulder until you're cleared to do so by your orthopedist or your therapist. Don't bear weight into your arm until you're cleared to do so. Continue to wear your sling at all times until you are cleared to remove your sling by your orthopedist or your therapist. And wear that sling at all times except when showering. Exit your bed from your non-operative side. A lot of this, again, we will go over with you with occupational therapy, but if you have any questions, if you get home and you forget everything that you were told while you're here, you will have resources to reach out. So you might get an email or text. We focus on our patient-reported outcomes, and to do that, you will get a survey prior to having surgery. We need to start that process preoperatively. If you get the text and email and start that survey up into the day of surgery, we can get you, but if you don't do it before surgery, we're not able to track you after surgery, so it's really important that you do that before surgery. It's just a way for us to help track your recovery, making sure that having the surgery and the reason you had it is doing what it needs to do for you. So it's a way for you to also communicate with us. It just takes about 5 to 15 minutes to complete. So again, just check your texts or emails and fill out that survey coming from Beaufort Memorial. And we appreciate the patient-reported feedback, and it just helps us follow you even in a year out after surgery. Okay, so we have gone over a lot today. If you have any questions, please don't hesitate to reach out. That is why I'm here, to be a resource for you before surgery, during surgery, after surgery. My office number's here, my email's here. If you call and I'm not in, please leave a message. It goes also directly to my cell phone, so very easy access. Your provider will also have somebody on call 24 hours a day. There is a page in your book just of numbers and resource numbers for anybody that you might need. So definitely check that page out and look at those helpful phone numbers. Don't hesitate to reach out and call. We want you to be as comfortable and feel like you are as prepared as possible to have this surgery. Thanks for joining us today, and I look forward to seeing you get back to your quality of life.